Welcome to Redline Project Radio, a periodic roundtable podcast brought to you by redlineproject.org. I'm your host, Jonah Nink, and joining me today are Redline Project student journalists Jaylene Rodriguez and Laaiba Mahmood. Their stories highlight some of the inequalities and disparities within the Chicago community. We've got a lot of important ground to cover, so sit back, relax, and let's get to it. We begin with Jaylene Rodriguez, whose story, COVID-19 Vaccine Distribution in Chicago, Disparities Among Neighborhoods, focuses on the inequalities present within the city's vaccine rollout. The story opens with an anecdote from community organizer Dolores Castaneda, who describes a neighborhood vaccination center with long lines and little regard for COVID-19 safety protocols.
Hearing Dolores' experience was eye-opening. Because she did such a good job at explaining why it's so hard for individuals in the city's South Side neighborhoods to get access to the vaccine. I included her story at the opening of my story because I wanted to put a face on the story. You know, these are real people with, real experiences, and I feel like that's important to show when you're just throwing a bunch of data at people. So firstly, the vaccination sites are not well equipped to serve their people on the South Side, as she mentioned. And many sites do not respect social distancing guidelines and are very unprofessional, unfortunately. Dolores said that these places were only taking names and numbers and claiming they would call people back with more information, but never followed up, never did they complete, the process of making these appointments for people. And additionally, she explained how housing in these neighborhoods, such as Little Village, are not very accommodating for social distancing. So, for example, if a family member were to contract the virus at work, chances are high for infecting other members. And also, individuals cannot afford to take off work. So they keep working even though they are sick because, they cannot afford to miss rent or not have enough money for food. So it's just a lot of these things together that makes it very hard for individuals to not only, avoid contracting the virus, but also getting vaccination to protect, themselves and their community.
Sure, yeah, and that's an excellent point at the beginning about sort of putting a face to this story, because I know with data-heavy stories that we focused on during the semester, it can be real easy to sort of get lost in the data, and it kind of becomes impersonal because it's just statistics. So putting a really good interview like that in the front just made your story especially compelling. And also at the top of the story, you have this really awesome map. It's a heat map of vaccinations by zip code. What can you kind of just walk us through it? Like what areas saw the highest vaccination rates, what areas saw the lowest? Kind of building off what you said back there, why might that be the case?
Yeah, so that map is a choropleth map, and it's a thematic map to represent statistical data in correlation to population. And that came about when we had one of our first assignments for our data class. Mike had asked us to find 3 substantial sets of data from the City of Chicago Data Portal website and analyze them, just explaining why the data is important, what story does it tell, etc. And when I came across the vaccination data, I knew I had a good story to tell, and I saw potential for the data to translate into a final project. Neighborhoods like Lincoln Square, Uptown, and Lakeview all had vaccination series completion records of upwards of 20,000 people. This is as of early May, so yes, numbers have changed, but I doubt that drastically. Now compare that to the city's South Side, where Little Village and Inglewood showed only about 5,000 residents who had completed the vaccine series. So just to put into perspective how many people, are completing the vaccine series and how many people have access to it, it's just, you can really see the disparity when you hear the numbers.
Sure, absolutely. And just kind of building off that, what do you think personally, just through what you've learned while researching the story and the people that you talk to, what creates this disparity? And did the data surprise you at all, or did it seem kind of par for the course?
No, the data did not surprise me. As stated in the article, vaccine distribution in Chicago is just a microcosm of racial disparities nationwide. And as of early May, like I stated, Chicago's majority Black or Latino zip codes averaged 5%. Majority white zip codes averaged 13%. What's important is completed doses. And we see that there's a large disparity amongst minorities and white Chicagoans concerning completion of the vaccine. And, it's less effective if you fail to receive the second dose, which puts, Blacks and Latinos even more at risk.
Sure. And you talk a lot about pharmacy deserts in Chicago, especially. It was a large issue before the pandemic, and it's only gotten worse because of the pandemic. Especially, it's only going to make the vaccine rollout especially harder. Do you think that the pandemic will finally force the city to confront pharmacy disparity between neighborhoods, or do you think that nothing will change?
Yeah, so like I stated previously, this story's goal was to show the racial disparity amongst one of the most important vaccine rollouts. And I think especially as of lately, with racism becoming more widely talked about in this country, things like lack of proper access to healthcare come to light. It was especially evident in the city when COVID-19 testing came about during the first few weeks of the pandemic. Neighborhoods in the South were showing less cases, but it's because, there was no testing available to them. And now with the vaccine, the lack of pharmacies in these neighborhoods is making it even harder for individuals to gain access to appointments and to receive the vaccine. There are 5 areas in the city with less than one pharmacy per 10,000 residents. 3 of them are on the south side, and the 4th one is on the far north side. And the 5th is O'Hare Airport. Just to put that into perspective. So I'm hoping that bringing these issues forward helps to alleviate the problem. Dr. Ehrman discusses how it should have been a priority to make vaccination sites available as easy as voting polls are. So your local schools, churches, and park districts should serve as your designated place to get vaccinated, close enough to where you live and accessible hours so it doesn't interfere with work. He describes that, this is public health. This is bringing, the vaccine to the people, bringing it to the, community and so on.
Sure. And you kind of just addressed this last question I had just then, but I wanted to ask, lots of community figures have criticized the rollout of the vaccines. What were their specific concerns, and what solutions or alternatives did they offer, and do you agree with them?
Yeah, so just to highlight that again, really bringing the vaccine to the people. So, Dr. Ehrman describes here, I can pull it up. Let me just read this off really quick. He states how,
You're all good. Yeah.
Yeah, he said, would you tell 100 workers at the Amazon warehouse at 27th and Western to each go on their own to get a shot? Or would you bring in somebody to administer those shots, all 100 people at the same time? And he says, it's just common sense. And that kind of, really puts perspective on the issues. Why are you asking, some people who cannot afford to take off time from work, who cannot, devoid from their daily routine to, go and receive the vaccine? It'd be easier if you brought these vaccines to the workplace, to the people. And same with making, the vaccine available to other people by making, your local schools, local churches, local park districts as vaccination sites. And as we see now, the city is doing mobile vaccination sites, for people who cannot physically leave their house. But even we're just in the beginning. So, the problem is still very ongoing.
Sustainable transportation is the way of the future, but does Chicago have the infrastructure necessary to handle it? Laaiba Mahmood and Vivian Sanchez tackled this very question, and the answer is a mixed bag. I sat down with Laaiba to discuss the remaining barriers between Chicago and cleaner transportation.
So, an electrical charging desert refers to an area where there are very minimal or no publicly available electric vehicle charging stations. So you've probably heard of food deserts before. These sort of refer to areas where people don't have access to grocery stores or other places where they can get food. And so this sort of mirrors that sort of concept where people are unable to publicly access electric vehicle charging stations near them.
Right. And, you know, your whole story is talking about just this idea that, you know, electric vehicles are going to be very, very prevalent in the next few years. But we don't quite have the infrastructure for it yet to, you know, with all those charging stations. So my kind of, you know, second thing I kind of wanted to talk about is your story opens with this really, really cool map of all the charging stations in the city. And can you kind of just walk us through what's on the map? You know, what communities are more likely to have an electrical charging station, and conversely, what communities are more likely to be an electrical charging desert? And like, why might that be? Why might that disparity be there?
Sure. So this map, this Google My Map, we compiled using U.S. Department of Energy data that was compiled at the Chicago Area Clean Cities website. And so based on this data, we organized and found that there are 235 publicly available electrical vehicle charging stations located within Chicago's community areas. And of the city's 77 community areas, 46 have no publicly available EV charging stations. And after we further analyzed this data, we found that only 26% of the stations available in Chicago's community areas are located in the city's southwest, far southwest, and far southeast sides. So it seems like the north side, northwest side areas, the Loop, these areas are pretty well equipped with electric vehicle charging stations, public electric vehicle charging stations, but communities on the west and south sides are not. And this, we talked to a professor from UIC. Her name is Dr. Elizabeth Koch, and she's the Director of Partnerships and Strategies with UIC Energy Initiative, and she's an adjunct faculty member. And she explained that this sort of follows a trend of investment where the city invests in areas that are already pretty well maintained, whereas the south and west sides typically don't see the same sort of investment in newer technology or stuff like that. And so, yeah, that's sort of what we found. And yeah, this map illustrates the deserts pretty well. Like you can see a lot of these community areas don't even have one, especially on the south side. So yeah.
Yeah, exactly. And, you know, the adoption of electric cars, you know, it's good for the wider environment, of course, but it's also a good thing for improving air quality in some communities. In your article, you had this really kind of, you know, eye-opening statistic that Black children in Illinois are 3 times as likely to have asthma than white children. Why does poor air quality affect Black and brown communities so heavily? And just kind of, as we were just talking about, how do you think more access to electric vehicles might help at least mitigate that a little bit?
Sure. So one of our sources, Netta Delamy, she's the co-founder for Chicago for Electric Vehicles. It's an organization dedicated to electric vehicle owners. She's the one that brought up this statistic that Black children in Illinois are at least 3 times more likely to get asthma than white children. And she brought it up because, obviously if air quality is poor, a lot of that comes from pollution, and regular cars that run on gasoline cause a lot of this pollution, a lot of trucks, a lot of, you know, trains and all these sorts of things that run on fossil fuels cause a lot of this pollution, along with a lot of other things. And so a shift to electric vehicles can help benefit better or help like produce the environment where there's better air quality for these communities. Yeah, I can't necessarily speak to why the statistic is higher, but I mean, I can make an assumption that based on sort of what I've already told you, is that the south and west sides are really densely minority populated, and like Black and brown communities barely heavily prevalent on south and west sides. And so these areas that typically don't see a ton of funding in well-maintained infrastructure, well-maintained public resources and stuff like that, I mean, you can kind of connect the dots there and see why air quality might be lower in these areas in comparison to other areas of the city, and why certain demographic groups are more heavily impacted by this poor air quality.
Right, exactly. And, we talked a lot about benefits of electric vehicles and the benefits of just having a better infrastructure to support those electric vehicles. But, there still are a lot of barriers that are preventing electric cars from being fully adopted, especially barriers in Chicago specifically. So I just wanted to ask what those specific barriers might still be, and what kind of solutions are people working towards to help us get past them.
Sure. So a lot of people think that electric vehicles are only meant for affluent white families. It's a pretty widespread social perception, but this is an incomplete reason as to why more people don't adopt electric vehicles. So a big issue, and one of the Dr. Coach who we talked to sort of explained it like this. It was Vanessa Perkins, who's the founder of the Illinois nonprofit organization Community Charging. She explained it as a chicken egg situation where if there aren't publicly available electric vehicle charging stations, people won't drive electric, but you also need people to have electric cars to build the infrastructure. So at least in this case, Community Charging, her organization, is working to install electric charging stations in neighborhoods that don't have as much access to charging stations. So on one hand, there are nonprofit organizations working to increase access by fundraising and installing the actual infrastructure in communities that need electric vehicle charging stations. Another issue that people face when buying electric vehicles, and this perfectly ties into the issue of electrical charging deserts, is range anxiety. And this is sort of the fear that because there aren't a ton of publicly available electric vehicle charging stations, people won't be able to reach their destination while driving without breaking down somewhere because they weren't able to charge. So that's another big issue. And I think Dr. Coach mentioned this just sort of question she asks her students in class. And I'll read you the quote. And I think it's really powerful to illustrate, just to get people pondering about this issue in electric vehicle charging stations. So
Sure. Yeah.
She asks her students, just think within a mile how many regular gas stations you can think of. There are at least probably 5 to 10. Now, how many can name one charging station in that same radius? Not many. So I think that really illustrates how just not being around electric vehicle charging stations can make it seem like you just can't have an electric vehicle. And, I mean, you literally can't, because you can't charge your vehicle. And the city council and the mayor approved an ordinance last April that required construction of new residential and commercial buildings to have 5 or more units, to ensure that at least 20% have 5 or more units and parking with over 30 spots, to ensure at least 20% of the parking spaces are accessible for electric vehicles. But that oftentimes doesn't do enough to address inequality citywide, because a lot of these new constructions happen in areas where they're going to be luxury homes or for higher income, richer tenants. And so these sorts of amenities are to attract higher income tenants, but it does little to ensure accessibility for residents in low income neighborhoods. And it can also lead to this issue of gentrification, which Dr. Koch left us with that idea of how when there is investment in an initiative like electric vehicle charging stations, it has to be very focused on the community and what the community's needs are, because otherwise it can sort of fall into this gentrification, cause a lot of displacement, and like really ruin the lives of the community you were trying to help in the first place.
This has been Redline Project Radio, a periodic roundtable podcast brought to you by redlineproject.org. I'd like to thank Laaiba and Jaylene for speaking with me today. You can find their stories and more on redlineproject.org. My name is Jonah Nink, and I'll see you next time on Redline Project Radio. Stay informed, stay safe, and thanks for stopping by.